Hello, everybody. Good afternoon. Welcome once again to a weekly COVID-19 public health update and media briefing with Montgomery County Executive Mark Elridge. I'm Laura Virgili, Hispanic Public Information Officer for Montgomery County Government. And joining us today is Dr. James Bridgers, who is the Acting Health Officer, as well as Dr. Earl Stoddard, Assistant Chief Administrative Officer, Mr. Sean O'Donnell, Program Administrator, Public Health Emergency Preparedness and Response for the Department of Health and Human Services. And today we have a special guest, Chief Administrative Officer, Rich Merolino. Thank you, everybody, for joining us. Good afternoon. And with that, I toss it to you, Mr. County Executive. Good afternoon to you.
Good afternoon, and good afternoon to everybody else on this call. I'm speaking today from the East County Regional Service Center, and I'll explain why in a moment. Last year, Chief Administrative Officer Rich Merolino, who's on today's briefing with us, came up with the 5 E's. These are broad issue areas that we're focused on in the county, and the areas are equity and advancing social justice, educational opportunities for all, economic development across the county, environmental sustainability to fight climate change, and efficiency and effective public service. And frankly, this has been a really good week for Montgomery County. We've made progress in each of these categories this week. So we're going to start with the Brookville Bus Depot EV bus charging solar microgrid. On Monday in Silver Spring, we took care of efficient and effective public services and environmental sustainability to fight climate change as we launched the nation's largest EV bus solar charging station and microgrid at the Brookville Bus Depot. By 2026, we anticipate using the self-sustaining facility to be able to charge our fleet of 70 electric buses. Electrifying that many buses will reduce greenhouse gas emissions by 62% over the next 25 years, according to our development partner, Alpha Structure. The energy service company helped finance and build the microgrid so that the county's upfront costs in this project were minimal. And those 70 buses are just part of the fleet that we'll be developing in the coming years. We have no doubt that this innovative project will soon be modeled everywhere throughout the nation as other jurisdictions get serious, as we have been, about reducing our carbon footprint. I want to thank the Department of Transportation in general and Department of General Services, our state and federal delegations, and our partners at Alpha Structure for this game-changing project for both our transportation infrastructure needs and our efforts to combat climate change. Yesterday, I was in the Up County for an opening of the Shepherd Pratt Community Wellness Hub, a wonderful one-stop shop that will provide healthcare, mental health, and other wellness resources to those who can't afford them. This wellness hub is going to be a model that we're going to be replicating across the county. It was amazing to see all of the nonprofits that are in this hub and the work they're doing, to serve residents in the Up County. We maintain the hub model in our budget going forward, and we fully intend to expand this model to other parts of the county. And so I'm looking forward to the work that we're going to be able to do. In other exciting news, Montgomery College expands to the East County. So today, that's why I'm in the East County right now, we get to take care of the 30 in one project, or 3 E's in one project. Educational opportunities for all, economic development across the county, as well as equity and advancing social justice. We just wrapped up a presser held by Montgomery College announcing the opening of an education center here in East County in the fall of 2023. The center is the first major expansion from Montgomery College in over 20 years. For an institution that is ranked among the top 10 community colleges in the nation and a community that needs closer attention and access to it, this wait has been too long. As you can see from this map from Montgomery College's feasibility study, over 3,200 MC students in East County have to commute between 1 and 2 hours on public transportation to get to their classes at other campuses. We have to do better, and I'm glad that everyone was on the same page to ensuring the funding and the vision for this new center. And you can see the routes and the maps up there. Less than a year from now, full coursework will be available in subjects like nursing, information technology, daycare certification, under one giant 55,000 square foot roof. This move is being supported with an investment in the US 29 BRT flash line. Our capital budget is committed $40 million in transportation infrastructure improvements, making this development in White Oak a public-private partnership. Hillendale and Fairland are two communities that also stand to benefit thanks to the recently launched ride-on bus transit route. Montgomery College is ranked number 7 in the nation for community colleges. It has built a reputation for meeting the socioeconomic needs of students and serving as a viable and affordable entry point to higher education. Placing Montgomery College Education Center here will help this diverse community take advantage of opportunities close to home with having to commit more commute times in order to realize their dreams. And this is important for local residents. In other parts of the county, community colleges are closer to the residential base, and students at local high schools are able to take advantage of the programs at Montgomery College that serve students that are still in high school. This is going to make that equally accessible to folks on the east side of the county. The center is also going to provide rigorous academic offerings, trainings, and an opportunity to earn advanced degrees and also certificates. And this not only is going to lead students to receive higher earnings, but it's also going to help the county retain and attract companies, new economic development opportunities, and create jobs. One of the important things that we get from starting this campus from scratch is they're going to be able to design programs that reflect the needs of key growing industries in Montgomery County. And so they have the ability to be flexible to address what we're seeing now in terms of demand for people in life sciences and in the IT world in particular, as well as hospitality. So this is going to be a big opportunity to link education that is directly in service of jobs that are being developed here in the county. We've witnessed the success that Northern Virginia has in better utilizing their higher education system and networks to lure companies and businesses. The academic offerings of Northern Virginia were specifically cited by Amazon when they chose Arlington County for their HQ2 headquarters. We're well on our way to doing the same in Montgomery County. I look forward to seeing this kind of opportunity to develop a school like this being born out of the Montgomery College East County presence. So it's a good day for education. It's a good day for East County residents. And it's a good day for us as we continue to seek to bring jobs to Montgomery County. And one of the big lures is to have a workforce that's ready to go to work in the jobs that will be coming here. Election day is next week. I think we all know that. It's actually less than a week away now. And I hope voters who are voting by mail are returning their ballots that they requested by mail and were sent out. Ballots postmarked or dropped in one of the many drop boxes in the county have to be dropped by November 8th in order to be counted. But the sooner you get them in, the sooner your votes will get counted. While I expect results to take time, I urge people to have patience and wait for the final results. I do not expect to see the same kind of delays that we saw in the primary, because during the primary, we were not allowed to count these ballots before, actually we had to wait till 2 days after the polls closed. State courts stepped in and they're changing when mail-in ballots can be counted. And so we should not have to wait as long for final results, and we should be getting the bulk of the returns in very quickly. I want to thank all of those who advocated and got this process changed. Voters do deserve the results that are tabulated accurately and timely. There are over 200 officials around this nation on the ballot next Tuesday that do not think the 2020 presidential election was correct, including officials on the ballot here in Maryland. This lack of faith in democracy is scary. And another reason why our election process must be free from interference, intimidation, or anything that would cause people to question the legitimacy of the count. That's why it's important to get the counts done quickly so people's imaginations don't go wild about what fiendish plot people have for the votes they cast. I want to thank everyone at the Montgomery County Board of Elections and all poll workers, volunteers, and observers for their service to this sacred process here. As far as the referendum items in this year's ballot, I'm glad to say the state is finally allowing the vote on legalizing cannabis here in Maryland. Surveys show that most Maryland voters support a referendum that would legalize cannabis for recreational use by those 21 and older. I've long supported the effort to finally end this part of the failed war on drugs. About all we've accomplished is to send lots of young people to jail, saddle them with criminal records, and render them unemployable for their futures. This is not a sound outcome of a judicial process or of a process of justice, period. And it's had a disproportionate impact on minority communities for decades. They're more likely to be stopped and to go to jail over marijuana possession than other folks are in the community. And smoking marijuana in public would still be banned and punishable by a fine starting at $250. But it's long past time to do the right thing and legalize reasonable amounts of marijuana. Now I'd like to bring in Montgomery County's Chief Administrative Officer, Rich Madalena, to talk more about the upcoming elections and the referendum choice voters will have on the county attorney's office. So I'll stop now and let Rich talk and take any questions after that.
Thank you very much, County Executive Elrich. I want to jump in and also welcome Katie Shepard to this phone call. I think we have her joining us for the first time from the Washington Post. So very nice to meet you, Katie. So the final question on the ballot, once you get to the very end of your ballot, is question A. Question A deals with a Montgomery County only question that deals with the appointment of the county attorney. Under current law, within the charter, the county attorney is appointed by the county executive and confirmed by the county council. When county attorney departs, the county executive can appoint a new one, and the county attorney can dismiss, the county executive can dismiss a county attorney. So what this question would do is in some ways grant a lifetime appointment to a county attorney, because it would say that unlike every other department director in county government, if the county executive wanted to dismiss the county attorney, he or she could only do that with the approval of the county council. So right now, for example, I serve at the pleasure of the county executive. He could walk in today and say, I can't stand the Washington Capitals, so you're out of here. And that would be that. But I'm confident he wouldn't do that. But I do recognize I serve at the pleasure of the county executive. So this would change that relationship with the county attorney and say the county attorney could only be removed by with the consent of the county council. And conversely, it would allow the county council to fire the county attorney, but with the consent of the county executive. This proposal came up at the last moment. It didn't go through the normal review process. We have a county charter review commission to look at these things, to think through the various consequences. Unfortunately, it didn't go through this process. The council moved on it at their very last session. And there's just a concern, I think, that the county executive shares, that elections have consequences. And if a new county executive is elected, why should that person be required to retain the services of a county attorney appointed by a prior executive? Now, County Executive Elrich kept the same county attorney on Mark Hansen through much of his first term, who County Executive Leggett had appointed. But now that we have just appointed, and the county council just confirmed last week, a new county attorney, John Markovs, should there be a change come next Tuesday, when and if there is another county executive, that legal advisor to the county executive should be the choice of the county executive, and not also be have to go through a removal process with the county council. The county executive proposed during the review of this a provision that said, like I believe Howard County has, that the county attorney serve a term appointed consecutively with the county executive. So when a new executive comes in, that executive can appoint a new county attorney if he or she desires. And then at the end of that term, that person could be retained by a new executive or returning executive or turned over. So I think it's a question of whether or not we should have a separate county attorney who is, again, given in essence a lifetime appointment. And in our structure, it's interesting, the county attorney is the legal advisor to the county executive, but only a legal advisor to the county council. They have other legal advice that is granted to them, which then creates, I think, a bit of potential conflict over who is providing the final legal advice for the county government. So with those issues in mind, in an effort to say, hey, again, elections have consequences, an executive should have the right to appoint a county attorney that he or she decides is in the best interest of the community. The county executive is recommending a no vote on question A, that study it more, come back and see if this is one of maybe several changes that are needed to the charter moving forward to modernize county government, but there's no need to rush a lifetime appointment for the county attorney, even though County Executive Eldridge just appointed an outstanding county attorney who was confirmed unanimously by the county council. And with that, I think I also was supposed to provide some numbers about what's been happening with the ballots. So far, as of last night, 32,700 people had voted using early voting in in Montgomery County. That compares to 77,000 4 years ago during the first 6 days. So early voting is down substantially in the county, but mail-in ballot requests, mail-in ballot submissions are way up. During the entire process 4 years ago, 37,000 mail-in ballots were submitted. We have already logged in 49,000 mail-in ballots this year. And there were 139,000 total requested. So most of those have been mailed out and we're waiting for them. As the executive said, they've got to be put in a drop box. We've got 50 drop boxes around the county. They have to be put in the drop box by 8 p.m. on November the 8th, or they need to be postmarked by November the 8th. If you're using the postal system, they will count ballots that come into the Board of Elections for up to 10 days after the election, but it must have a postmark by November 8th in order to be eligible to be counted. So this year, the process will be slightly slower because of the email ballot provision. People can have a ballot emailed to them, print it out themselves, fill it out, sign it, send it back in with the right documentation. But that ballot then has to be completely recreated on one of the formal paper ballots because our scanners can't read just the paper from anyone's printer. So it has to be duplicated onto another ballot with 2 judges. That process can be quite slow. And so far, we have 23,000 email request ballots. So we could have nearly as many ballots come in this year by self-printed ballots than we had nearly in all the ballots 4 years ago. And again, that is a cumbersome process that takes a slightly more time. So just trying to let people know our Board of Elections would love to count as quickly as possible and get out the results, but there are some limitations to the structure that we use in Maryland that we ask, again, as the executive said, everyone to be patient to get the accurate results. But fortunately, because of the court decision, that counting and canvassing is going on now so that on election night, we will have tens of thousands of mail-in votes counted and able to be those results released after all polls close on the evening of November 8th. Thank you.
Thank you, Mr. Madalino. Members of the media, this is a time where if you have questions regarding elections, we're going to open it up for that. Only questions about elections, other questions after the public health update. So I'll give you a second or two so that you use the chat and see if anybody has questions.
Helen Pickles,
Hi, Kalan. How are you? Good afternoon.
Doing well. Did I interrupt anyone? I'm sorry.
No, just go ahead. You go ahead.
Hi, Mr. Madalena. Can you clarify real quick whether that 23,000 figure was for Montgomery County or the state?
Oh, yes, all the numbers I used were Montgomery County only numbers.
Great. And can you repeat those figures real quick?
Sure. There are 139,000 requested mail-in ballots for Montgomery County. Of those, 23,000 have been requested to be sent to the voter by email. So they print them out themselves, fill out the ballot and send it back in. The others, the formal printed ballot is mailed to those individuals. That so far through 6 days of early voting, 32,700 voters have used early voting to cast a vote. And that compares with 77,000 from 4 years ago for the first 6 days. So in fact, overall, the last 2 days of early voting have traditionally been the busiest. And so the final early vote count from 4 years ago in Montgomery County was 113,000. It's hard to imagine we will get 80,000 early voters during the next 2 days. So I think you see a movement of people from early voting or voting in person to mail-in ballots, since again, there were only 37,000 mail-in ballots submitted 4 years ago. And again, there are already 139,000 mail-in ballots requested and 49,000 returned and logged in.
Thank you, Kalantan Sudath from WAMU. Next up, Heather Curtis, WMAL. Hi, Heather. Good afternoon.
Hi, I'm doing well. How are you guys?
Good.
I'm wondering, Mr. Madaleno, you were saying that ballots will be counted, assuming they're postmarked by November 8th, for up to 10 days after the election if they're mailed. Do you have any concerns that, given all the issues with the post office, people may mail in their ballots, they're postmarked by November 8th, but they get in too late to be counted?
That is always a concern, and that's why we have so many drop boxes across the county that anyone can just walk in and just drop it in. They are picked up 2 times a day by a team of bipartisan election judges. There's one right in front of the executive office building, in fact, where I see people come every day and drop them in. So if people are concerned about the mail, you've got the drop boxes. And during the primary, I think there were very few ballots that were postmarked by the primary date, July 19th, that did not arrive before July 29th. So our experience before was that the 10 days is usually enough time for ballots to get in. Clearly, if someone by chance is watching this abroad who is a voter, please don't wait in casting and sending in your ballots from abroad, because as the Board of Elections will show during the count, we do receive ballots postmarked from all over the world, as you have Marylanders serving in a variety of capacities all over the world or working all over the world.
Is that it, Heather? Is that it for you?
One more quick question, if you have a minute. Wondering, we've heard things from other jurisdictions and other parts of the country about, some sort of things that could be considered voter intimidation happening near drop boxes. Are you at all concerned that people may, have issues? And obviously Montgomery County is different from some of the places where we've heard these things have happened, but are you concerned that people may have issues when they're submitting their ballots? And have you seen any of that?
I don't know if the county executive wants to answer that question first, or if he wants me to take it.
I don't know of any, and I would not be surprised if some incidents occur, but I can't think of anything offhand that's come to our attention.
We have been actively engaged with the law enforcement. Our law enforcement agencies have been actively engaged with the FBI. We have no We have not seen or heard of any threats of that sort of activity here. So people know, every ballot box is monitored by an HD camera 24 hours a day. So any attempt to interfere with it or to cause a problem near it, we are watching. All of the devices, all of the drop boxes have a fire suppression unit inside of it. So they are designed to withstand an attempt at vandalism or destruction. So there is some thought that's going on, that has gone into the way Maryland runs its drop boxes and secures them for the safety of the voter and the votes.
Great, thank you so much, gentlemen.
Thank you, Heather. Up next, Steve Bonnell, but that's a beat. Also questions regarding elections for the CAO. Hi, Steve. Good afternoon.
Afternoon. I just had a question on question A, which Rich had kind of addressed. I've read about this before, and what's interesting is that the former county attorney Mark Hansen had at least been part of recommending this to kind of remove the unintended bias of the county attorney serving either under just the executive or legislative branch. That's at least what he had said, in arguing this. I just want to give you a chance to respond to that, because obviously you just offered a lengthy explanation, but either of you can kind of field that, because I want to give you a chance to respond to that.
So I'm not too hurt, Steve, that you referred to my comments as lengthy, but
well, it was descriptive.
Yes, I know. I know it's one of the attractive features of my personality. Nothing. No, I would say that, and I believe in reflecting the opinion of the county executive, elections have consequences. An executive should have the right to the legal counsel that he thinks is going to provide the best advice for the residents of the county, and not have to be limited to just the person who had been in the office before. That being said, interestingly, the county executive, when he came into office and during his first 3 years in office, could have made a change with county attorney, but did not, and kept Mr. Hansen on because of his value, experience, and perspective, representing the county government as someone who I believe spent 3 decades in the county attorney's office, eventually rising to county attorney. So, and I think the whole idea is another executive, should one be elected on next Tuesday, or when another executive takes office, should not have to just stick with Mr. Markov's if this is if there is a change in executives.
So I guess, and it's interesting philosophically, because obviously the council unanimously approved Markov's, who's been in the office a long time himself, but is it the view that the legislative branch and the executive branch should have, I guess, different chief legal advisors at that point? Because that's, I guess, how it's functioning now, essentially. But I just pulled up the charter, and it was interesting. It says that the county attorney is supposed to represent the county, just the county, period. So
Yes.
That to me is the philosophical debate here. And if that's the model I described, that's how you feel, then I understand the argument, but I just want to make clear I'm understanding it.
Well, and there is a provision in the charter that says the county attorney is the legal advisor to the county executive, but a legal advisor to the county council. So the council can use additional legal advice. The executive is only allowed the legal advice of the county attorney. We tried to suggest, okay, if you're going to have this person as, in essence, a pseudo-independent lifetime appointment, they should be the legal advisor to both the council and the executive. And the council decided against making that change. So, it's interesting that an executive is required to deal with just the county attorney, whereas the county council can seek their own legal advice, which seems a bit of a mismatch. But that's one of the things we wanted to work through with the Charter Review Commission, let's talk about these things, as opposed to, and think about the various consequences, a different structure. You know, this is based on a model city charter that the International City Managers Association has available. And, you know, our thought was, all right, that's, you know, if this is one change that is recommended, maybe there are some other changes that should be balanced at the same time. So that's why the executive is again recommending a no vote on question A.
Okay. Now that I might have put everyone to sleep, thanks, Rich.
Steve, I think I'd add that you know, the council has its own, has its own attorney, and so it's kind of weird that the council would retain somebody who they refer to as the council's attorney, and that the executive has. I can't suggest that they fire this person or have a vote on firing. This is totally their decision. And then on the executive side, for the council to say, well, no, you don't get to have your attorney, that we have the ability to try to remove that person. It's a really unbalanced situation, and it puts one attorney accountable to two bodies where their attorney is only accountable to the county council. So it's hard to understand why they're doing this from an operational point of view.
Thank you both.
Thank you, Steve. Members of the media, any other questions for Chief Administrative Officer Rich Madaleno regarding elections? Going once? Twice? No questions? Thank you.
So Lorna, since we already heard about the 5 E's of Montgomery County, we're going to be turning it over to the 6th E of Montgomery County, Dr. Earl Stoddard. Right?
Eventually, yes.
Thank you.
So Rich, just one thing I want to
you.
clarify. If you requested a mail-in ballot and then go in and vote in person because you haven't returned it, then your vote won't get counted until they verify that there's not a mail-in ballot that's come in from you as well. So you might well delay having your vote counted if you choose to vote in person, if you'd already requested a mail-in. So if you've requested a mail-in, please drop it off. You know, you don't have to stand in the lines or anything else, but it's gonna at least it'll get counted faster than if you opt to vote in person with that mail-in ballot hanging out there.
If you do show up to vote in person after requesting a mail-in ballot, you will be asked to vote a provisional ballot. And what the executive was saying, excuse me, what the executive was saying is a provisional ballot gets counted at the very end, so that it's after they've canvassed almost all of the absentee ballots do they get to the provisional ballots. So that's why it will be counted, but it will be amongst the last to be counted.
Thank you, Mr. County Executive. Now we can continue with the rest of the news and the public health update.
So I'll start with the update on COVID. We have had a slight uptick in COVID cases though our community threat level still remains low. However, we're seeing more non-COVID respiratory illnesses driving people to the hospital. This is very concerning, especially as we're heading into the winter months. We're especially concerned about the number of children hospitalized with RSV, a common respiratory illness that is hitting communities across the nation earlier than normal. And that may be driven by the fact that many children have not been exposed like this in quite a while. When everybody was wearing masks, our exposure to flu and our exposure to RSV was reduced, as was our exposure to COVID. Now that fewer people are wearing masks, you're seeing increased exposures, and RSV is a problem for young children. It can be a problem for older adults, and all these things contribute to people landing up to the hospital, which obviously is a problem. So it's important that people think about this, and you may well, I would certainly suggest, particularly if you've got young children, wearing a mask and making sure they wear a mask. And we'll continue to monitor hospitalization rates to make sure that things don't get to the point that we're jeopardizing the capacity of our hospitals. we may be ready to have our kids to return to school and after school activities, but our immune systems have had this long break, and it's longer than what's normal. So please be aware of RSV if you're a parent, and look out for symptoms in their children. I did note that there was a report that one of the drug companies has a vaccine for RSV, but I don't know that it has been approved yet. I just noted that they said they had produced a vaccine. So hopefully, if it's approved, that'll provide a little bit of relief in this area as well. As far as our COVID rates, with more people visiting hospital with flu-like symptoms leading to more tests and a slight uptick in positive cases, health experts are referring to it as a wavelet. They expect COVID-19 cases to rise over the upcoming weeks. But as we said before, we're hoping that we can keep them not too much more than 100 cases per 100,000 residents. Our main concern, and will continue to be, the rise in hospitalizations and the strain on our healthcare systems during the fall and winter. The other thing which we haven't seen yet is understanding which of the variants have any peculiarities. Like, are we dealing with a variant that bypasses vaccines or bypasses immunity from a previous case of COVID? All that can affect the number of people who get sick and ultimately end up in a hospital. And we see more strains at higher levels of presence than, and you can see that in this chart. You know, we were dealing with this before. You'd have one variant like, say, BA5, and then you'd have a bunch of subvariants, and the subvariants would be pretty small. But right now, you've got BA5 having fallen to about 47% of the cases. And then you've got, the next variant is almost 17%. The next one is 11%. The third one is 10%. And the fourth one is a little over 8%, I guess. And so those four variants, comprise a pretty significant number of cases. So you can see the virus is changing and producing more variants, and you're getting more variants at the same time. So everybody is paying attention to what this means, and are these variants different? Will their impacts be different? And how effective will our current protections be given the different variants that are out there? The other development with COVID, as I said, is the variety, well, it's not the other, this variety of Omicron that we're seeing in the county. Sean's going to go into that in more detail. So we'll talk more about that in the rest of the report. We have to remember that the Omicron variant is different than the original COVID strain, but now we have a vaccine that's specifically made to protect against the Omicron variant. And that's why it's important for families in Montgomery County to seek out bivalent boosters for anyone 5 and up, and if it's been more than 2 months since their last COVID vaccine. As the county's Boosterama, I was at the county's Boosterama last weekend at Westfield Wheaton. We had more than 100 families come in and get their shots. We had a steady stream for 3 hours that we were there, and I want to thank Westfield Partners, along with Latino Health Initiatives, Por Nuestra Salud y Bienestar, and the DHHS department for organizing this event. I'm also appreciative of the media coverage, which also helps us get the word out about the importance of the boosters as well. Getting folks their bivalent booster over the next 3 weeks prior to the beginning of the holiday season is really critical. So far, only 14% of all county residents have gotten their bivalent booster, and 24% of those are over 50 have taken the shot. So we have disproportionate age difference in who's taken the shot, but we have generally a very low number of people taking the shot. And that means you're not going to be having the protection you could have against the Omicron variants. And these new variants that are coming up so far seem to be subvariants of the Omicron strain. Getting the flu shot is also a priority, as this flu season is predicted to be one of the worst. The county has a free flu clinic next Thursday, November 10th, from 9 a.m. and 3 p.m. at the Dennis Avenue Health Center in Silver Spring. Appointments are required, and you can make one by visiting montgomerycountymd.gov/flu. Most pharmacies and urgent care centers and healthcare providers in the community also offer the flu vaccine. I was able to get it on a walk-up basis myself. Vaccines are our best defense against viruses like COVID and the flu, but you can still protect yourself by washing your hands regularly and staying away from people who are sick. So now I'd like to turn this over to Sean O'Donnell for his presentation, and he'll also give us an update on the monkeypox situation.
Thank you, County Executive Elrich. Just following up with what our county executive has shared, again, the feedback from the CDC data project looking at typing our variants and our subvariants is showing a range of subvariants. These are all Omicron strains. These are all most of these are part of the BA.5 or BA.4 strains. Again, and this is the component that was specifically added to the bivalent booster. And so this is why it's so important to get the most recent booster, even if you've had previous boosters of the monovalent. As was mentioned, we're seeing a little uptick in people who are testing positive by PCR for COVID. That may be driven by more and more people who are visiting hospitals, emergency departments for respiratory illnesses, and more of them are being identified as COVID. The overall number of COVID inpatients has not changed dramatically in our county. We've seen a little uptick in hospitalizations. Mostly those numbers now are patients who have been transferred over to the alternate care site in Tacoma Park. Looking at our data on deaths with a COVID diagnosis, we are still likely to get a few more, possibly more data on October as we're recently out of it, and it can take a little while for official mortality data to come in. Death certificates sometimes take a little while pending some other lab results. However, it does look like our numbers came down a little bit in October, again reflecting the past month, the lower transmission rates we saw, the lower hospitalization rates we saw for the first time in a few months. Again, we are, as we're tracking our residents coming out for vaccinations, we're seeing good numbers of them come out for the for these bivalent boosters. It's still much lower than what we're hoping for. We just want to remind people, don't wait until just before you go to those family gatherings for Thanksgiving. It does take about a week for you to gain full immunity from a vaccination. So please come out a little bit sooner and get that protection before you visit family. Looking at what we're encountering at our hospitals, at our urgent care centers, at other places, just want to start with our essence data on emergency department visits. And this is for any illness that presents with any sort of respiratory illness and fever. So a fever of 100 degrees or higher, and a cough or sore throat. And you can see here from the left that the number of patients visiting our hospital emergency departments has gone up significantly with these keywords in the initial complaint. When you look to the right, you can see we've broken that down by age groups, and what's driving that elevated number is primarily the 0 to 4-year-olds and then the 5 to 17-year-olds. So it's our pediatric populations are having much higher rates of respiratory illness accompanied with a fever. When you get into slightly older ages, it's not until you really get to 50 and above that you start to see those increases again. And those are just beginning to happen with our seniors, and those are likely to go up as well. Again, these are all the groups that are at greater risk for things like respiratory syncytial virus, which we'll talk about in just a second. Looking at our nationwide influenza surveillance, you can see on the right, that's our updated chart. That's about 4,000 positive tests reported to the CDC by labs across the nation. So certainly nowhere near the actual numbers of say, COVID infections that we're seeing, but we're seeing influenza go up compared to the left, which shows you a full year of data. You can see we're already about midway towards the peaks that we saw last year in influenza. And they're happening much earlier than what we've seen in previous years. Looking at, again, this is Sentinel providers who report respiratory illness across the influenza season. So this is like our essence data. This could be any respiratory illness. And you see low levels in 2020 when people were essentially staying home and masking. And then when you look at 2021, when you look at 2019, which is red, which is just before COVID hit, very, very high levels of respiratory illness during the winter time, the late fall and early winter. And you see in 2021 last year, the onset was about the same time. And then it kind of came down as Omicron really hit us. This year, way over on the left, you see that yellow line. You see how much earlier in the year we're having an increase in respiratory illness. And again, it's not just influenza, it's some other illnesses as well. And you can see across the US, again, this is being driven by those younger age groups, the 0 to 4, the 5 to 24 are the much higher percentage of respiratory illness. When we look at in Maryland, across our state with Essence, once again, you can see the influenza-like illnesses is happening much earlier. That's the yellow compared to the previous 2 years. And again, you see that the 2020 line is very flat line there. I think it really does indicate how effective a lot of the control measures were in 2020. We're certainly not advocating going back to such impactful measures right now, but as an indication of how they may have helped with reducing COVID cases, you can see how they helped reduce other respiratory diseases. When we're looking just in Maryland on influenza-associated hospitalizations, again, you can see they're starting to go up already. Again, volume-wise across the entire state, not nearly as impactful as COVID has been, but this with other respiratory illnesses with COVID as well can all compound the challenges that our healthcare feel, as well as what we see in our schools and what we see in other locations. Looking at RSV, once again, this is across the nation. We're not the only area that's experiencing this much earlier. This is happening nationwide. That's that blue line on the far left. You can see it's happened much earlier than in previous years. And when we look just across Maryland, we can see that our test positivity is very high. Again, this is not something that everyone is being recommended to be tested for, but we're still encouraging parents with very young children or children with underlying conditions, particularly respiratory conditions. Please, if your child has any illness, please consult with your healthcare provider as soon as possible to get recommendations from them. They can help rule out other diseases. And then just an update on our vaccination levels. Across Maryland is about 17% vaccinated for the flu. Montgomery County is around 21%. Again, we know that this is typically a little bit earlier in the flu season, and some people may have planned to get it a little bit later. We're strongly encouraging, because we're seeing that activity go up now. Go out and get your flu shot. Don't wait a couple of weeks, or you may end up, unfortunately, getting that immunity by becoming ill. Finally, just to turn to our MPOX, we continue our surveillance. Maryland is now up to 711 cases. That's an increase of, I believe, 11 cases over the last week in the state. And talking with our colleagues in DC and Virginia, we're still seeing some new cases occur. Fortunately, in Montgomery County, across the nation, they've come down extensively. We're still seeing some occur. Montgomery County has only had one new case in the last 3 weeks. We're still offering vaccinations, of course, to individuals who are at risk and following up with potential exposures. That is all from my report. I just wanted to see if Dr. Bridgers or Dr. Stoddard have any additional comments they would like to make.
Thanks, Sean. Just one quick update. I just got an alert from the Metropolitan Council on Governments for the nation's capital region. The monkeypox, mpox declaration state of emergency has been extended through January 31st, but you aptly touched on it. We've had one case over the past week, so we continue to push forward and administer those vaccines. We had about 2 months ago, we had about 3,500 doses. I think we're down to under 200 now, so we are administering the doses, and we continue, of course, along that continuum of prevention. So just wanted to add that.
Thank you, Dr. Bridgers. Dr. Stoddard, do you have any initial remarks? We do have a hard stop at 2:15.
Yeah, I just want to give one second comments. I do want to thank the work of the Department of Health and Human Services, Office of Emergency Management, Homeland Security, the City of Rockville, Fire Rescue for the response to the 880 College Parkway fire on Monday. We had 52 adults and 10 children displaced by that event. Some of those displacements are going to be lengthy, and the Department of Health and Human Services continue to work with families. The one thing I want to put out there is if there are families who have not been in contact with Health and Human Services already, please do reach out to the number 240-447-2693 if you need assistance from that fire. Thank you.
Thank you, Dr. Stoddard. Okay, members of the media, we open it out for Q&A. Please use the chat. And we do have a hard stop at 2:15 this afternoon. So we have 15 minutes to answer your questions. I don't see any requests for questions quite yet on the chat, but we'll give it a second or two. Any questions, members of the media?
Yes, hey.
Regarding the public health update? Oh, there's Kate Ryan.
There I am. Hi.
I knew you were there.
I wanted a quick follow-up with Dr. Stoddard on
Go
that
ahead.
bit of information. The 52 adults, 10 children, was the cause of that narrowed down? We heard a burning through the floor under an HVAC unit, but was it a wiring? Was it the HVAC unit itself? Do we know? And when we say these people may be out for some time, are they being sheltered, or did they find their own, friends and family who could help out? Just a little more on that.
Yeah, so cause of the fire is still under investigation. I actually reached out to, I have to reach out to Chief Goldstein and see if there's any updates today, but as of yesterday, it was still under investigation. They have a couple of leads that they want to just make sure that they can track them down and figure out they're still looking for one of the occupants of the, not that they had been injured or anything like that, but that they just need to connect with one of the occupants of they believe the source apartment on that one. And so most of these units are condos, which means that for the most part, they have homeowners insurance that would cover any loss of availability of the unit. In some cases, they don't have insurance, in which case those are the people with whom HHS is doing their normal case management work. We have one of the more well-developed sheltering programs in anywhere in the state or in the region. And so this is not our first experience with this. And so we work with people. There are 2 buildings that are displaced. One of the buildings is believed to be relatively minor utility-related issues, so their displacement should be pretty short. The other building experienced pretty substantial damage to the roof and the roofing, and that can be a lengthy repair period that ranges. It has a great range, but usually 4 to 8 months is what we like to say when you have a roof damage of the kind that they experienced on Monday. So that will be a much more lengthy displacement for those residents.
Wow, thank you very much.
Thank you, Kate. Members of the media, any more questions?
Hey, can I jump in here? Sorry.
Yes, go ahead, Steve. But that's a beat.
Hey, County Executive, this is kind of a shot in the dark here, but the council passed a bill yesterday that pertains to radon testing and inspection.
Mm-hmm.
I assume you're going to sign that.
Yeah.
Okay. As a general rule of thumb, I assume you review each bill, but are you supportive of bills as they come across your desk? If you don't, I guess it's case by case, and I don't have a crystal ball here, but Do you get what I'm asking? Just if bills.
If I'm not supportive, I'd veto it.
Yeah,
But you know, that was the radon bill is a good bill. And, you know, Craig and I had worked on that back when I was on the council. So I was really happy to see the extension of it.
okay. Thank you, sir, and happy birthday.
Thank you.
Thank you, Steve. Any more questions, members of the media? All righty then, going once? Twice? No more questions? I guess we're done for today. Have a great afternoon, everyone. Stay safe, and we'll see you again next time. Bye-bye.
Thank you.